Welcome back to my channel. And if you are visiting my channel for the first time, you are also highly welcome. In this lecture, we'll be looking at humerus. Going through this lecture slide, we'll be describing the different features of the humerus. We'll be highlighting also the different muscles that are related to different specific regions of the humerus, highlighting some details that you should know as students of anatomy. Humerus, we say that it is the skeletal framework of the arm region. The humerus is classified as a long bone. Using this image by the side, this is where we have the humerus here, carried in blue. You see that it is a long type of bone. It is also the longest of all the bony components of the upper limb region. If you look at the entire upper limb, you see that we have a number of long bones in that region. We have the radius, we have the corner. So comparing in terms of length with the other upper limb bones, we say that humerus is the longest. And because it is a long bone, it is seen to have a shaft, which is also referred to as the handle, so two ends. So it is seen to have a proximal end and also a distal end. Using this image by the side, this is where we have the proximal end here, carried in yellow. The proximal end is at the superior part. So it is the superior end. And it is through this superior end that it creates articulation with the glenoid cavity or glenoid fossa of the scapula. This is where we have an indentation here, highlighted in black on the lateral border of the scapula. And this is what is referred to as the glenoid fossa or the glenoid cavity. This indentation is seen to receive the head of the humerus, and this is where they create the glenohumeral joint that is also referred to as the shoulder joint. So this is where we have the creation here of the shoulder joint or the glenohumeral joint. It is at the proximal end of the humerus that this joint is created. But if you go more inferiorly at the distal end, you have a connection with the proximal regions of bones of the forearm region, which include the radius and also the ulna. And this is where it creates the elbow joint. If you look deeply into this joint, you see that we have two sub-joints created around the space. If you look at this point where this arrow is directed to, we have the humeroulnar joint. This humeroulnar joint is where the distal end of the humerus connects with the proximal region of the ulna. And if you go on this lateral region, we have the humeroradial joint, which is where the distal end of the humerus connects with the proximal end of the radius. So you see that at the elbow joint, it connects with both the ulna and also the radius. And this is where we have the creation of the elbow joint. In addition to this joint, around the elbow joint, we also have the radioulnar joints. The radioulnar joint is created between the radius and also the ulna. So there's also another third joint that is created around the elbow joint. This will be highlighting on in our lecture on the elbow joint. But at this point, it is important for us to highlight that the distal end of the humerus creates a connection with both the ulna and also the radius at this inferior region. And this is where we have the formation of the elbow joint. So you see it creating joints at both the proximal and also distal ends. So now let's go to the functions of the humerus. The humerus, as we initially described, creates the skeletal framework or alignment of the arm region. This is where we have the arm region, this is where we have the forearm region, and this is where we have hand region. So going back to the arm region, you see that the skeletal framework of this region is formed by the humerus. So you see it forming an alignment here onto which other structures will be laid up. Then it is seen to form joints. So you see that the proximal end of the humerus, it is seen to form a joint with the scapula. Also at the distal end of the humerus, it is seen to form a joint with the radius and also the ulna. It is also seen to create attachment site for muscles. As we go through with this lecture, we'll be describing different sub-regions of the humerus and also highlighting the different muscles that are related to it. Just for us to know that the humerus creates the site for some muscles to attach. So now let's look at the proximal end. So using this alignment here in dotted blue, at this superior region here is where we have the proximal end. When inferiorly to this region, we have the shaft or the handle. Then if you go more distally at this region that is carved out in this lower portion, we have the distal end. We already described that the humerus is a long bone. We should expect that it would have a shaft and also two ends. So now that driving it into the proximal end. In the proximal end of the humerus, we have the head. There is a particular way onto which the head of the humerus is directed. And it has to be directed in this way, just for it to be able to fit perfectly into the glenoid cavity or fossa of the scapula. Don't forget that the major aim of the head of the humerus is to create a joint. And in order to create a joint, it needs to fit into a sub-region of another bone in creating this joint. And for it to be able to align perfectly with this bone, it needs to be directed in a particular pattern. And it is important that we highlight this. So you see that the head of the humerus is directed slightly backward and also upward. And it is seen to be directed medially. If you look at this alignment here, this is where we have the head of the humerus here, carried in blue. If you look at the way it is directed, you see that it is first directed medially, and it has to be directed medially because the glenoid cavity that you'll be fixing into is located at the lateral border of the scapula. So if the indentation is on the lateral border, it means it needs to be directed medially for it to be able to fit into it. And it is also seen to be slightly backward and also upward. And this is in a way to perfectly align with the glenoid cavity or fossa of the scapula. So you see that this is where we have the medial side and the lateral side. And you see that the head is truly directed medially. And just after the head, we have a slightly constricted region, which is the anatomical neck. And this is what is highlighted there in yellow. Don't forget that when you have the head, the next constricted region that you see is the neck. Well, in this case, it is the anatomical neck, which is the structural neck. This constriction is what is seen to be highlighted at this point. If you go more inferiorly to this constriction, you have the two tubercles. These two tubercles are protuberances or eminences, and they are created at both the medial side and also on the lateral side. So this is where we have the lesser tubercle that is medially placed, and you see it to be lesser because it is smaller in size. And if you go more laterally, you have the greater tubercle, which is greater because it is bigger than the lesser tubercle, and it is also seen to be laterally placed. This is where we say we have the medial side and this is the lateral side. And you can see that the lesser and the greater tubercles are also medially and laterally placed respectively. In between the two tubercles, you have an indentation, which is referred to as the intertubercular sulcus. Don't forget that these two tubercles are eminences because they are swellings. In between them is a depression. And this depression is what is referred to as a sulcus. Because it is the tubercles, it is referred to as the intertubercular sulcus. This intertubercular sulcus can also be referred to as the intertubercular groove. Groove is also an indentation, or can be referred to as the bicipital groove. We'll be highlighting more on this, why it is also referred to as the bicipital groove as we go through with this lecture. More inferiorly to the tubercles, we then have the surgical neck. This is the surgical neck here, highlighted in black. The surgical neck is surgical because it is the more constricted region around the proximal end of the humerus. And this pronounced constriction is what makes it to be prone more to fracture because impact will be more felt at this region cause fracture. So this is why this region is referred to as a surgical neck. So these are the different projections seen around the proximal end of the humerus. So now let's drive in more into the different specific regions of the proximal head of the humerus. The first region that we describe in the proximal end of the humerus is the head. This is where we say the head is located. We see that this head is directed medially, and it is also seen to be slightly upward and also backward. And if you look at how it is projected, you see that it is truly directed medially. We already highlighted why it should be directed medially in our previous slide. We said that the indentation, which is the glenoid fossa or cavity that it will be fixing into, is seen at the lateral border of the scapula. When a region is located on the lateral border and the head of the humerus needs to fit into it, it needs to be directed medially. And this is why it is seen to be directed medially. The head of the humerus is also seen to be lined with hyaline cartilage. Don't forget that it is through this head that it creates an articulation with the scapula. And we know that articular surfaces are usually lined by hyaline cartilage. So this is why you see hyaline cartilage lining on the head of the humerus. This is to allow for easy sliding across the articular surfaces at joints. This is where we have the scapula highlighted in green, and this is why we say that the head of the humerus needs to be directed medially so as to be able to attain the alignment of fixing perfectly into it. Other attribute that it presents in terms of how it runs is that it is slightly positioned backward and also upward. It is in order for it to perfectly fit into the indentation that is created from the scapula. If you go more distally or more inferior to the head region, you have anatomical neck. This is the anatomical neck here, carried at this point. We say that this is a slight constricted region after the head. And the structure that is seen to be related to this region, in case we're asked during our examination, is the articular capsule. Don't forget that we have articular capsule around the joint space, connecting the head of the humerus to the glenoid cavity of the scapula. So this articular capsule is also seen to extend anatomical neck here of the humerus. The next structure that you have are the tubercles. First, we have the lesser tubercle. This is the lesser tubercle here, carried in red. We already described previously that this lesser tubercle is smaller and it is also seen to be positioned more medially. Don't forget that this is the medial side and this is the lateral side. So it is seen to be smaller in size when compared with the greater tubercle. And the muscle that is related to the lesser tubercle is the subscapularis. Don't forget that this is the scapula. So we have the subscapularis, which is the muscle that is seen within the subscapular fossa, extending, and you see the fibers inserted on the lesser tubercle of the humerus. This subscapularis is one of the rotator cuff muscles, and it is just this single muscle that is seen to be connecting onto the lesser tubercle. And this is what is projected here in dotted red. So using this lower image, this is the anterior surface of the scapula. And at this point here is where we have the subscapularis. If you look at the subscapularis, it's filled into the subscapular fossa. And you see it finally inserted here at this lateral region onto the lesser tubercle of the humerus. And this is what is harrowed there at this point. So this is this muscle that is related to the lesser tubercle of the humerus. Then if you go more laterally, the next structure that you see as a protuberance or an eminence is the greater tubercle. And this is what is harrowed there in yellow. We say this is greater because it is larger in size when compared to the lesser tubercle. It is not only larger in size, it is also seen to be more laterally placed. So this is laterally placed, while the lesser tubercle is medially placed. So if you have during your practical examination to identify the two tubercles, you should first place the humerus in an anatomical position, should be able to deduce which is the medial side and the lateral side. So you can now correctly state which is the lesser or the greater tubercle. You should also know at the back of your mind that these two tubercles are seen after the anatomical neck. So this is what is projected up here. This greater tubercle, we say, is larger and laterally placed, and it is seen to be related to three muscles. So on the greater tubercle, we have three facets. These three facets are described as the superior facets, the middle facets, and an inferior facets. These three facets are related to three different muscles. So now let's go through it. If you look at the greater tubercle here, we have the superior facet. This superior facet is related to the supraspinatus muscle. Don't forget that the supraspinatus muscle is located at the posterior surface of the scapula. It is located at the superior surface of the scapula. That is superior to the spine of the scapula. And this is what is related to the superior facet on the greater tubercle of the humerus. Then if you go to the middle facet, that is also highlighted here in yellow, you see the infraspinatus muscle. The infraspinatus muscle is located below the spine of the scapula at the posterior surface also of the scapula. And this is what is attached here to the middle facet on the greater tubercle of the humerus. The inferior facet here, that is also highlighted in yellow, is related to the teres minor muscle. The teres minor muscle is seen to run from the lateral border of the scapula, and you see it finally connecting onto the inferior facet here on the greater tubercle of the humerus. Using this lower image here, this is where we have the supraspinatus muscle at the posterior surface of the scapula. And this is seen above the spine of the scapula. This is where we have the spine of the scapula that divides the posterior surface of the scapula into the supraspinous fossa and an infraspinous fossa. We know that these two fossae are seen to contain different muscles, and they are seen to contain the corresponding named muscle. So we have the supraspinatus muscle and we have the infraspinatus muscle contained within the supraspinous fossa and infraspinous fossa respectively. So at the infraspinous fossa, we have the infraspinatus muscle that is also carried here in yellow. And if you go to the lateral border here, just inferior to where we have the glenoid cavity or glenoid fossa, we have the teres minor muscle. So you see this muscle running from these 3 points, and you see the fibers are finally directed and inserted on the 3 facets on the greater tubercle of the humerus. Don't forget that the 3 facets are already being positioned in the superior, middle, and inferior region. So each of the muscles will take their corresponding facets and are inserted on the greater tubercle of the humerus. And this is what is projected here in this upper image. These 3 muscles, the supraspinatus, infraspinatus, and the teres minor muscle, are 3 rotator cuff muscles. These muscles are seen to be inserted on the greater tubercle of the humerus, taking up their corresponding facets. While one of the rotator cuff muscles, which is the subscapularis, is seen to be inserted on the lesser tubercle of the humerus. So you see that the rotator cuff muscles are located all on the tubercles created on the humerus. While 3 are inserted on the greater tubercle, 1 is seen to be inserted on the lesser tubercle. This is what we've tried to explain using this slide. So now let's drive further on the proximal end. Don't forget that we already described the greater and the lesser tubercle. Between the lesser and the greater tubercle, because we say they are eminences, we have an indentation like a gutter created between them. And this indentation is referred to as the intertubercular sulcus. This intertubercular sulcus can also be referred to as the intertubercular groove. We also say that we can refer to this groove as the bicipital groove. If you look at this lower image, this is where we have the lesser tubercle, and this is where we have the greater tubercle. This is the medial side, and this is the lateral side. Don't forget that the head is directed medially. So in between these 2 eminences, you have a gutter or a groove created in between them. And this is what is referred to as the intertubercular sulcus. This can also be referred to as intertubercular groove. We say that this groove is not created for fun or for fancy, but it is created to accommodate a structure. And the structure that is seen to line through this indentation is the tendon of the long head of the biceps brachii muscle. And this is what is seen to pass through this indentation. Try to use this upper image. This is where we have the biceps brachii muscle. Don't forget that the biceps brachii muscle is located in the anterior compartment of the arm, and it is seen to have 2 heads, and this is why it is referred to as biceps brachii muscle. Biceps brachii muscle has a long head and a short head. This is the short head here, arrowed in black, while the long head, arrowed there in red, is seen to pass through the intertubercular sulcus and finally seen to insert on the supraglenoid tubercle that is highlighted here in yellow. There is a tubercle above the glenoid fossa that is referred to as the supraglenoid tubercle. It is this tubercle that finally receives the tendon of the long head of the biceps brachii muscle, and that is after it has been seen to pass through the intertubercular groove or sulcus. And this is what is projected here in this image. And this is why it is referred to as the bicipital groove. Bicipital from the biceps brachii muscle. So we can now understand how these names have been generated. It is also important for us to add that the intertubercular groove is seen to have 2 lips. Don't forget that it is a groove or an indentation, which means that there is going to be an eminence on both sides of it. And these eminences are referred to as lips. These lips are basically edges. So we have on the medial side, and we also have on the lateral side. You try to use this lower image. This is where we have the intertubercular groove or sulcus or the bicipital groove. If you look at its medial side, there is a lip, which is an elevation. And on the lateral side, there is another lip, which is also an elevation. So these are referred to as the medial and lateral lips. They are basically edges because of the groove that is created between them. These 2 edges or lips are also related to different muscles, and would be highlighting this also in this slide. So for the medial lip, it is seen to be related to the teres major muscle. If you look at this medial lip here on this side, This is where we have the teres major muscle. We know that the teres major muscle is seen to originate from the lower or inferior angle of the scapula, and it is seen to be inserted at the medial lip here of the intertubercular groove or sulcus. If you try to use this image by this lower side, this is where we have the teres major muscle here highlighted in blue. You can see it originating from the inferior angle of the scapula. Finally, it is inserted here on the medial lip of the intertubercular groove. And this is what is projected here in this lower image. And this is the region here where the teres major muscle is finally inserted upon. So if you go back to the lateral lip of the intertubercular groove or sulcus is related to the pectoralis major muscle. Using this image here at this lower side, highlighted here in black, this is where we have pectoralis major muscle. You see that the fibers of this muscle is finally inserted on the lateral lip of the intertubercular groove or sulcus. If you go back to this image, this is where we have the alignment of pectoralis major muscle. The pectoralis major muscle is located in the anterior chest region, and you see it emerging from the sternum and also the clavicle, and you see them collected and directed where they are finally inserted here on the lateral lip of the intertubercular groove. And this is what is also harrowed at this point. So in between the insertion point of the pectoralis major muscle and also the teres major muscle, we have the latissimus dorsi. So if you go back to this image, we have the latissimus dorsi here, taking its insertion point at this region. So you see it located between the insertion point of the teres major and also the pectoralis major. This is why the acronym, a lady between two majors, can be used to remember this insertion point around the lips of the intertubercular groove. If we go back to this lower image here, this is where we have the latissimus dorsi. The latissimus dorsi is the muscle of the lower back region, and it is seen to have multiple sites of origin. It is seen to originate from the spinous process of the lower thoracic vertebrae, the iliac crest, and also the lower ribs. From these regions, it is seen to be directed and inserted here between the insertion point of the teres major and also the pectoralis major muscle. So it is seen to be located in between them. So if you go back to this image, you see that the latissimus dorsi is inserted between the two majors, which include the pectoralis major muscle and also the teres major muscle. So these are the muscles that are also related to the different lips of the intertubercular groove. Then going further, the next structural region that we have around the proximal head of the humerus is the surgical neck. Using this image here, this is where we have the surgical neck. We say that it is the more constricted region. It is more constricted than the anatomical neck, and this is why it is more prone to fracture. We also have vessels that are related to the surgical neck of the humerus, and we'll also be highlighting on this. If you go to the surgical neck of the humerus, we have the axillary nerve here highlighted at this point. So you have axillary nerve related to the surgical neck of the humerus. The axillary nerve is an emergence from the brachial plexus, and you see it around the neck here of the humerus. You also see the circumflex humeral vessels. The circumflex humeral artery is a branch also from the axillary artery. And we know that the axillary artery is a continuation from the subclavian. After subclavian would have given off a number of branches. So you have the circumflex humeral artery from the axillary artery, also having anterior and posterior branches. And these branches are also seen around the surgical neck of the humerus. So the axillary nerve is a nerve that may be damaged when you have fracture around the surgical neck of the humerus. And it is important that we highlight this. So now let's go further to the shaft. We already know that after the proximal end, the next region here is the shaft. The shaft of the humerus is the handle, and it is generally seen to be cylindrical around its upper half and flat around its lower half. So it presents a kind of triangular flattened presentation around its lower half. It is also seen to have three surfaces. And in establishing or really understanding the three surfaces of the humerus, it is important that we create a landmark that is the anterior border. If you look at this alignment here, harrowed at this point, this is the anterior border of the humerus. This anterior border of the humerus is created from the alignment superiorly from the crest of the greater tubercle. This is where we have the greater tubercle here. We say it is laterally placed, and this is where we have the lesser tubercle. So the crest, which means the topmost region of the greater tubercle, an alignment is followed downwards along the shaft. And this alignment is what creates the anterior border of the humerus. Borders generally are edges. So it is onto this border that is created that we then begin to establish our surfaces. So if you go to the anterior medial side here on this region that is harrowed and dotted green, this is where we have the anterior medial surface. It is anterior medial surface because it is medially placed, even though it is in the anterior side, but it is anterior medial because you already have a border, which is the anterior border created. So you have the anterior medial surface highlighted in dotted green. This anterior medial surface is related to two muscles. It is related to the coracobrachialis, also the brachialis muscle. If you try to use this image here, this is where we have the coracobrachialis muscle. This is what is seen to be carried here in green. You have this muscle originating from the coracoid process of the scapula. If you break down the name of this muscle, you see that its emergence is from the coracoid process. This is why it's so referred to as the coracobrachialis. And you see it inserted on the brachium, which is the humerus. So you see its final insertion points here around the middle third of the anterior medial surface of the humerus. And if you go back to this other image here, we have the brachialis muscle. This is where we have the brachialis muscle here carried at this point. The brachialis muscle is seen to originate from the distal half of the anterior medial surface, and this is what is carried here at this point. And you see the fiber is directed across the elbow joint, where they are finally inserted on the coronoid process and also the ulnar tuberosity. And this is how they run along the anterior medial surface. So these are the two muscles that are related to the anterior medial surface of the humerus. And we've tried to establish how they originate and also where they are finally inserted. On this further end here, we have the anterior lateral surface because it is directed laterally, even though it is still within the anterior side. So we have the anterior lateral surface here. And this anterior lateral surface is related to the deltoid muscle. This is where we have the deltoid muscle here, carried at this point. We know that the deltoid muscle is seen to form the curvature around the shoulder region. And you see that this muscle also originates from a number of points. It's seen to originate from the spinous process here, also the acromion. You see it originating also from the lateral region of the clavicle. So you see it coming together and forming a rounded contour around the shoulder. And this is where it is finally inserted here on the anterolateral surface of the middle of the humerus. So you see that in the anterolateral surface, we have the deltoid muscle. On the anteromedial surface, we have coracobrachialis and the brachialis muscle. Then the next surface that we have of the humerus is the posterior surface. The posterior surface is located behind. It cannot be seen here in this image. It is seen to be located at the posterior region. And this surface is related to both the medial and the lateral head of the triceps brachii muscle. The triceps brachii muscle has 3 heads. Because it is triceps, it is seen to have 3 heads. So it has the medial, the lateral, and also the long head. It is the medial and the lateral heads that are related to the posterior surface of the humerus. The long head, there is a way it is positioned that does not really have a direct connection to the posterior surface of the humerus. We would also be highlighting more on the triceps brachii muscle when we get to that aspect in our lecture series. So these are the muscles that are related to the different surfaces of the humerus. And we try to establish how these surfaces are created. So the shaft of the humerus is seen to also have 3 borders. Don't forget that it has 3 surfaces. In our previous slide, we tried to establish how these surfaces are created. So these borders are also 3 in number. We say that borders are basically edges. So we have the anterior border. Don't forget, we already described the alignment of the anterior border in our previous slide. We say that the crest of the greater tubercle, this is where we have the greater tubercle. So the alignment of the greater tubercle down in the anterior surface is used to mark the anterior border of the humerus. And this is the anterior border here of the humerus, running an alignment upward from the crest of the greater tubercle. So the next border that we have is the medial border. The medial border will then be the region where the anteromedial surface will be transforming into the posterior surface. Don't forget that there's a posterior surface behind. So we can try and imagine how these borders or edges are created. If you go back to this image, this is where we have the anteromedial surface. And this is where we have the anterolateral surface. We already described the basis behind these surfaces in our previous slide. We said that the surface that is located medial to the anterior border is the anterior medial, while the surface that is located lateral to the anterior border is the anterolateral surface. And this is what is projected here in this image. While behind, we have the posterior surface. These are the surfaces created. Now the borders, we already highlighted the anterior border, which forms an alignment with the crest of the greater tubercle. And this is what is heralded at this point. So the medial border will then be the border or the edge that is created when the anterior medial surface becomes transformed into the posterior surface. So there is a edge that will be created around this region that is heralded at this point at this medial end. So this is the medial border. Then we have a lateral border that will be created on this other end, where the anterolateral surface will be connecting or meeting with the posterior surface at the lateral region. So this is going to be the lateral border. So we can try and imagine how these borders will be created. And there are edges where we have a transformation of one surface to the other. For the medial and the lateral border, they are inferiorly continuous as the supracondylar ridge at the inferior region. For the medial border, it's continuous as the medial supracondylar ridge, while on the lateral border here, the lateral border is continuous here as the lateral supracondylar ridge. Just a corresponding name ridges, which means that at this inferior extension, there is a transformation of the borders into ridges, and the ridges are also taking their corresponding names. These ridges are basically for the attachment of muscles. We'll also be dwelling more on this as we go through with this lecture. It is also important for us to note that on the posterior surface of the humerus, we have the radial or the spiral groove. This radial groove, from the name, it is seen to accommodate the radial nerve, and it is seen to be located at the posterior surface of the humerus. This groove is seen to be broad and shallow. It is also seen to run in an oblique pattern. We try to use this image by the side. This is where we have the Olecranon fossa, which is at the posterior region of the humerus. We'll also be expanding more on this as we go through with this lecture. This is just to mark here that this is the posterior surface of the humerus. So at this region that is heralded in dotted black is where we have the radial or the spiral groove. You can see that this groove is an oblique groove. It is not deep, but it is seen to be broad. And this is what creates the accommodation for the radial nerve. The radial nerve is one of the branches also from the brachial plexus, and it is also seen to accommodate the deep brachial artery. And this means that when you have fracture at this region, which is the mid-shaft fracture, it may be seen to damage the radial nerve. So it is important that we highlight the different nerves that may be damaged at different specific regions of the humerus. Don't forget that the surgical nerve, we say it is related to the axillary nerve, which means that the axillary nerve may be damaged when you have fracture around the surgical neck. So if you have a fracture around this mid-shaft region, it could also damage the radial nerve. Now let's look at the lower region of the shaft. Still on the shaft, but at its lower region, we have the medial supracondylar ridge and also the lateral supracondylar ridge. Remember, we already talked about this in our previous slide. This is where we have the medial supracondylar ridge. This ridge is seen as an inferior continuation of the medial border of the shaft of the humerus. And this is what is heralded at this point. We say that this ridge is created for the attachment of muscles, and these are the muscles that are seen to be connected to this region. And these muscles include the brachialis, the pronator teres, and the triceps brachii muscle. It is also seen to be connected to the medial side or medial region of the intermuscular septum. The intermuscular septum is a septum that divides the muscles in the arm region. So it divides them into the anterior and the posterior compartments. And the medial region of this intermuscular septum is also seen to be connected to the medial supracondylar ridge. Well, on the lateral side here, we have the lateral supracondylar ridge. This lateral supracondylar ridge is also an inferior region of the shaft of the humerus, and it is seen as an inferior continuation of the lateral border of the humerus. Remember, we already described the lateral border in our previous slide. So if we go towards the inferior region of the shaft, you have this lateral border then transformed into a ridge. And this is what is referred to as the lateral supracondylar ridge. This ridge is also created for the attachment of muscle, just as what the medial supracondylar ridge also presents. And we have a number of muscles connected to this region. And these muscles include the brachioradialis, the extensor carpi radialis longus, and also the triceps brachii muscle. It is also seen to connect also with the lateral aspect of the intermuscular septum. Remember, we said that the intermuscular septum is what separates the muscles in the ham region into the anterior and the posterior compartment. So you have the lateral region of this intermuscular septum also connecting to the lateral supracondylar ridge. If you go back to the medial supracondylar ridge, remember we said that the medial region of this intermuscular septum is connected to this region. So these are the structures and muscles that are connected to the supracondylar ridge. And we know that the supracondylar ridge is at the inferior region of the shaft of the humerus. So let's go to the distal end of the humerus. The distal end of the humerus is the inferior end, and it is also seen with different features that would be highlighting within the slide. The first pronounced structure that is seen around the distal head of the humerus is the trochlea. The trochlea is like a pulley-like structure that is seen to run in the anterior and the posterior surfaces of the humerus. If you look at this structure here, this is the anterior surface and this is the posterior surface. And this region that is harrowed here in red is where we have the trochlea. Trochlea is also seen to extend to the posterior surface, and you also see part of it also at the posterior region. You see that it is a pulley-like structure that is seen around this region. And this structure basically is seen to fit into the trochlear notch of the ulna. This is where we have the ulna here. There is an indentation on the ulna that is referred to as the trochlear notch. Trochlear notch means is a notch for the trochlea. And this is what the trochlea of the distal head of the humerus will fit into to create the humeroulnar joint. And this is one of the joints that is created around the elbow region. Then if you go more laterally on the trochlea, there is a rounded structure that is referred to as the capitulum. This is the medial side, this is the lateral side. So we should expect that this region here on the lateral side, where we have the capitulum. If you look at the capitulum on the posterior side, you see that it is not seen, which means that the capitulum is limited to only the anterior region. So it is not seen to extend to the posterior surface as the trochlea. And what this capitulum fits into is the head of the radius. This is the radius, and this is what receives the capitulum here on the lateral side. So you see that on the lateral side, there is a creation of the humeroradial joint, while on the medial side, there's a creation of the humeroulnar joint. These two joints is what forms part of the joints of the elbow joint. And this is what is projected here in this image. In the distal end of the humerus, we have three depressions. We have three fossae that are created, which are non-articular regions of the humerus. They are not articulating with any structure. They are just created there so that at full extension and flexion, the different processes around the elbow joint will have a space to intrude into. We have two depressions in the anterior surface, and we have one in the posterior surface. In the anterior surface, on the medial side, we have the coronoid fossa. This is where we have the coronoid fossa here, harrowed at this medial side. This coronoid fossa, just as the name implies, is an indentation that receives the coronoid process. If you go back to the upper region of the ulna, this is where we have the ulna here. We say that the ulna has an indentation that is referred to as the trochlear notch. We say that this notch is what receives the trochlea. So if you go to the anterior aspect of the trochlear notch, we have the coronoid process. This is the coronoid process here, harrowed at this anterior region. It is this coronoid process that extends into the coronoid fossa when the arm is fully flexed. So at full flexion, this coronoid process is seen to extend into this fossa so as to give easy wheel of flexion around this region. Then if you go on the lateral side, you have the radial fossa. This radial fossa receives the head of the radius at full flexion. So when there is full flexion at the elbow joint here, the radius is seen to intrude into the radial fossa. So you see that these spaces are created already for structures to intrude into them when full flexion occurs. Then if you go to the posterior region, we have the olecranon fossa. The olecranon fossa, this is where we have the posterior surface of the humerus, and this is the olecranon fossa. This olecranon fossa is seen to receive the olecranon process. Don't forget that there is another process around the posterior region here, which is the olecranon process. And this is what extends into the olecranon fossa at full extension. So when you extend the elbow, there is a space for this process to extend into. And when you flex, there are also spaces in the anterior surface of the humerus at the distal end for the head of the radius on the lateral side and also the coronoid process on the medial side to also extend into. So let's drive further on the distal end. After describing the different features, which include the trochlear and also the capitulum, and also the different fossae on the anterior surface, which include the coronoid and the radial fossae, and at the posterior region, we have the Olecranon fossa. So all these structures are located around the distal region of the humerus. Then if you go more superiorly above the creation of this structure, we have the epicondyle, which means that this lower structure, the trochlear and the capitulum, are seen as the condyle. So the structure that is located above them are the epicondyle. So this is where we have prominence is created above this region. So if you look at this image, this is the anterior surface and this is the posterior surface. This is the medial side and this is the lateral side. So on the lateral side and on the medial side, we have epicondyles. These epicondyles are protuberances created above the trochlear and also the capitulum, which are referred to as the condyles. So if you look at it on the medial side, we have the medial epicondyle. On the lateral side, we have the lateral epicondyle. These epicondyles are projections or expansion created around the spaces. If you look deep into the medial epicondyle, you see that it is larger than the lateral epicondyle. Basically, these epicondyles are created for the attachment of muscles. For the lateral epicondyle on the lateral side, it is seen to connect or be associated with muscles around the posterior region of the forearm, which are basically the extensor compartment of the forearm. And these muscles include the extensor carpi radialis brevis, the extensor digitorum, the extensor digiti minimi, extensor carpi ulnaris, the supinator, and also the anconeus. If you look at how these muscles originate and also where they insert upon, you will see that they are related to the lateral epicondyle of the humerus. While the medial epicondyle also is created for the attachment of muscles also, but they are specifically seen to be related to muscles that are located in the anterior compartment of the forearm, which are basically the flexor compartment of the forearm. And these muscles include the flexor carpi ulnaris, the palmaris longus, the flexor carpi radialis, pronator teres, flexor digitorum superficialis. So these are the muscles that are related to the medial epicondyle. And it is important that we also highlight this in case you may be asked during your examination. It is also important for us to add that there is a groove that is referred to as the ulnar groove. This groove is located behind the medial epicondyle. Don't forget that we said that the medial epicondyle is larger. At the posterior region of the medial epicondyle, we have an indentation that is created here. And this is what is highlighted here in dotted white. At the posterior surface of the medial epicondyle, this groove is seen to accommodate the ulnar nerve. The ulnar nerve, we know that it's also a branch from the brachial plexus, and it is seen to run through the posterior region of the medial epicondyle. So it is important for us to also have a fracture that will occur at the distal region of the humerus, specifically targeting the medial epicondyle, may be seen to damage the ulnar nerve. So you can see that we have different nerves running through specific regions of the humerus, and fracture at different sub-regions may also be seen to affect also the nerves that run through this region. So now let's look at the joint that is formed by the humerus. And this should come easy because we already described this in our previous slide. So proximally, we have a joint created, and distally, we also have a joint created. At the proximal region, we have the shoulder joint or the glenohumeral joint. This joint basically is the head of the humerus fixing into the glenoid cavity or fossa of the scapula. And this is what is created at the superior region. In the lower region, we have the elbow joint. We know that the elbow joint is a complex joint, and it is seen to have a number of subjoints. And at this inferior region, we have two joints created at the distal end of the humerus. And this includes the humeroulnar joint. The humeroulnar joint links the trochlear of the humerus with the trochlear notch of the ulna. And this is seen also with the humeroradial joint. The humeroradial joint basically connects the capitulum of the humerus with the head of the radius. And this is what is also seen at this further region. So you have these two joints created around the distal end of the humerus. We say that in the elbow joint, we also have the radioulnar joint. The radioulnar joint is created between the radius and the ulna, but these two bones are not located in the palm region. So it is also important that we have this. But these are the joints created by the humerus at proximal region and also distal region. Clinical anatomy. It is important that we highlight fracture of the humerus. At different regions, different nerves will also be involved. So for the proximal fracture, specifically around the surgical nerve, is expected to affect or damage the axillary nerve. We already also described this in this lecture. Then if you go through the mid-shaft fracture, the radial nerve may be damaged. Then at the distal region, if you have a fracture specifically targeting the medial epicondyle, you should expect the damage to the ulnar nerve. We can also have dislocation. Don't forget that humerus also forms articulation with bones at the proximal end and also at the distal end. And this articulation can be subjected to dislocation. The head can be displaced from the glenoid fossa or the glenoid cavity. And also the capitulum and also the trochlear can also be displaced. So we can have dislocation also at different points where the humerus are seen to create joints. Thanks for watching this video, and I hope that you find this video useful.